Hello, everyone. I trust you're good and I trust you are already on your journey to weight loss. We are in this series where we are talking about weight loss and we are saying it's possible. It is very possible. It starts with you. You can do it and nothing can stop you. My name is Dr. Benny and welcome to Weight Loss Program and also welcome to this podcast. I want to help somebody out there to say, the information that I give here or the information that I share here, it is for educational and motivational purposes. If you're going through something around your body and everything, please seek the professionals. All right. So in the last segment, we were talking about why you need to exercise as part of weight loss, why you need to exercise. But today we are approaching another level where we are now saying, remember, I mentioned that I am the author of this book here, My Journey to Weight Loss. You can find this book on Amazon, My Journey to Weight Loss by Dr. Benny. And this book, I have mentioned a lot of things. So we shall be dissecting those things as we go. So today, from this book, we are then saying, how do you start your weight loss journey? How do you start? And honestly, doing a full blood test by your doctor is the best way to go, if not the smartest way to go. It turns weight loss from guesswork into a guided medical informed journey. So it's very important. Go and sit down with your specialist physician, go and sit and speak to your general practitioner so that they can help you. So let's break down why it matters in a simple, practical way, why it matters for you to have a blood count first before you start weight loss. So you'd find that you need to check hidden medical conditions. That's number one. You need to check hidden medical conditions. So sometimes weight gain or weight loss resistance isn't just diet, it's medical. I want you to know that a blood test can detect a lot of things in your body. So you find that hypothyroidism, it can also be identified, and then slow metabolism can also be identified. Type 2 diabetes can also be picked up by those tests, and polycystic ovary syndrome can also be picked up by those blood tests. And then what we call Cushing syndrome can also be picked up in those blood tests. So it's very important so that before you start to go on a weight loss, there are certain things you shall avoid that are going to matter into your diet. And there are certain things you're going to eat more which are not supposed to be taken more. So in the second one, we want to say that you need to access or you need to assess your metabolism and hormones. It's very important. Hormones control fat storage, hunger, and even energy. So key hormones that are checked, they are thyroid hormones, all right? The T3, T4, and the TSH. They are going to check that through the blood test. And also insulin, they are going to check your insulin resistance. How is it in your body as well? They are going to check also cortisol, stress hormones, so that at the end of the day, these are the stress hormones. They're the ones that detect, are you affected by stress or are you going through stress? They're also going to check what we call the estrogen, all right, testosterone. So it's very important. So imbalances in our bodies can cause stubborn belly fat. If there's something that is calling or causing an imbalance in your body, they can then activate stubborn belly fat, and then they can also cause fatigue. So you're feeling fatigued, or it means there's an imbalance there. And then also sugar cravings, whereby you really want to eat something that is sweet and you're feeling I must eat something sweet. It means there's an imbalance. And then also what we call weight plateaus. So you'd find that it's very important for you to sit down with your medical doctor so that they can take you down with all those tests and check all those things. And then the other thing is to identify nutritional deficiencies. So you'd find that if your diet you are eating a diet without knowing deficiencies, you may feel even worse Did you know that? You may even feel worse, not even better. So common ones are tested, which doctors that want to test in your blood the deficiencies. They want to check iron, they want to check vitamin D, they want to check vitamin B12, and they also want to check folate. It's very important. So deficiencies themselves, if they are present in your body, they tend to cause certain ailments or certain conditions that are going to happen on your body. One of it is hair loss. So you might start to lose your hair. It means there is a deficiency that's happening there. Extreme tiredness, whereby you feel very tired. It's also a sign to show that something is not good. And then dizziness. You could be starting to feeling dizzy. You are standing, you can't stand for long. Already you are feeling dizzy. It means there is an imbalance, or there is a deficiency, something is wrong, or a poor workout performance. Now that you've done a workout and then you're feeling very exhausted, or you're feeling pain and all that, these things needs to be checked before you start a weight loss program. It's very important, so that whatever you are doing during your weight loss, it's working in tandem with your body. All right. The fourth one is to check liver and kidney function. It's very important. So weight loss, especially rapid or keto type diets, there's stresses detox in organs. I want you to know that you'd find that with certain types, because there are so many types of weight losses, you could be doing a rapid one, or you could be doing the keto type of a diet. It's very important to know that whilst you're doing that, the blood tests are assessed, so that they check for certain things that could affect your weight loss. One other thing that they can check when they are doing the liver and kidney function, number one is fatty liver disease. They want to check, do you have a fatty liver disease that's starting, or that has been there, or that has been going unabated, all right? And then secondly, they want to check the kidney strain. Are your kidneys not strained? Are you feeling hydrated? Are your kidneys working well? The kidney levels, are they doing well? And then also they want to check poor detoxification. They want to check that. So if abnormal diet must be modified, so that everything is in order. The whole point, everything must just be good before you start a weight loss program. Because if you just start it without checking all these things, it might be a way to start to create another problem, because there are certain things you're going to avoid in weight loss, when in actual fact your body is needing those things. All right, so let's go. The fifth one is to evaluate cholesterol and heart risk. This is very important. So baseline cholesterol helps to track improvement. I want you to know that. So there are tests that they are going to do, checking your cholesterol, to check if your LDL, which is called bad cholesterol, is it good? Is it on good levels? They also want to check the HDL, which they call the good cholesterol. All right, the good cholesterol. And then also they want to check that the triglycerides in your body, are they good and are they low? Because if they are more, they are going to be clotting. All right, they are going to be causing the clotting of your arteries. So this is key if weight loss is for heart health. So it's very important. I want you to know that. And also, you need to personalize your weight loss plan. If I were you, the fact that you have chosen to say, I want to go into weight loss. And always remember, whenever you're doing weight loss, don't be pushed by anyone, and don't be coerced. Let not people laugh at you. Let you not do it because people are saying this. No, take it upon yourself. Like I did. Take it upon yourself and say, I'm going to do this. I'm going to carry on, or I'm going to delay and do it when I'm comfortable. Instead of genetic dieting, results guides, let me tell you, the results that you need are good results that are going to build your body. So you could either be focusing on your calorie targets, all right? You could be also focusing on your carbohydrates tolerance. You also be focusing on supplement needs, and then exercise intensity. All those are things that you are making sure that you are doing everything in the best way that your body must be happy. So example, if you have low iron, avoid extreme fasting. So if your iron levels are low, you mustn't do extreme fasting, because at the end of the day, you are not going to get the result that you're looking for. And also, if you have thyroid issues, slower monitored loss is ideal. You don't have to go drastic. You've got to be doing slow and monitored. So you shall see that when you start to do this, you are doing it in a proper way. I want to help somebody before you start weight loss. These are the things that you are supposed to ensure that they are all in line, in sync, and in check. So if they are in line, in sync, and in check, it means you are doing the right thing for your body. So this you can get. Go and see your specialist physician, go and see your GP, sit them down, and then they can run all these tests in your body so that when you start, they advise to say your iron is low, so make sure that you do ABCD. Your bad cholesterol is not looking good, your good cholesterol is not looking good, so let's go this route. This is the best way that one can start their weight loss. So I'm happy that when I wrote this book, it's also included. So you are not starting it from a place of not knowing, but you are starting it from a place of knowledge, from a place of reading and understanding. That is the way to go. Guys, if you are new to this channel, you've just passed by, I want you to subscribe. Subscribe to this channel. And if you are the regular, the people, the family, the community, like the video and let's share it. Let's push the algorithm. Let's help somebody out there. Let's leave no stone unturned. It is our duty to ensure that if we are doing something, let others enjoy it too. I'm happy. I'm enjoying my weight loss program. And to me now, it's now a lifestyle. So you start with weight loss and then you move to lifestyle. I love you guys. This is Dr. Betty. I'll meet you in the next podcast where I'm going to be coming with another topic. So stay tuned and keep watching. Turn your notification button so that the moment I post, you can get it. Share this podcast with someone. Take care and continue to live well. Your wealth is also your health. Your health is also your wealth. Take care. Bye.